Okay. So, hi, I'm Roxy Vandendries. I am a clinical nurse educator at Sanford. I have my master's in nursing education, and I'm a board certified nurse planner for nursing education. I became a Mint member in 2016, and so my journey since then has just been incredible. I've had the privilege of educating over 1,000 people in motivational interviewing, and that's both with Sanford Health, where I work, and I've worked there over 27 years, and then within my own business, MI Consociate. So been a mix of the two. But I was invited here again this year, and I'm super excited. And I'll actually be talking about using motivational interviewing with adolescents because we know that they are a special breed of human beings, right? And so, how do we connect with them using motivational interviewing? Everyone should be able to see my screen, correct? Okay. So, what we'll be looking at today is the spirit of MI and its application with adolescents. We're going to describe the update from evocation to empowerment and identify traps to avoid when interacting with adolescents. So, I thought I'd start with this very dire view of adolescence. Shakespeare said, if I were there no age between 10 and 3 and 20, or that youth would sleep out the rest, for there is nothing in between but getting wrenches with child, wrongdoing, the ancientry, stealing, and fighting. Wow, that's a pretty negative of view of adolescence. And thank goodness that isn't what we actually see when we look out in reality. We have such a pool of potential, um, just potential to grow up into very wonderful adults. And so I wanted just to start off too by saying that Doctors Miller and Rolnick published a new book in August of 23. So in case you weren't aware of that, they've had some changes. And so if you hear me use language that sounds like it's not right, it's probably one of the updates because they changed their languaging and what they call some of the things that we talk about. So one of the things they changed was their definition. And they say MI is a particular way of talking with people about change and growth to strengthen their own motivation and commitment. I'm assuming some of you have had training in MI. Maybe all of you have had training in MI. But just as a refresher, then, their definition really talks about not us being motivators, but us being tour guides and helping people find their inner motivation for change. Because then that'll always be with them no matter where they go. And if we motivate them, once they're not with us, then that motivation is gone. So starting off with the spirit of MI, I'll probably spend more time on this slide than any of the others. But partnership, how can we apply um, this partnership to adolescents? When two people are working towards a common goal, they have mutual respect. We do not take that expert role. And that can be hard sometimes because we do have that expertise. But we need to remember that they are the expert in themselves. Nobody else can be. And so we respect that they are that expert. If we do take that expert role, then a partnership can't be formed. And without a partnership, they won't trust us. And they can remain in that defensive position that oftentimes adolescents find themselves because of, struggling to try to find their place in life. Um, instead truly take collaboration and guide that conversation, but don't direct it. Instead of saying, you have to quit smoking weed, it's bad for your brain. Instead say something like, what are some of the reasons that others want you to quit smoking weed? I just want to pause here for a minute. Some adolescents, especially in the younger group, would have trouble taking a third party perspective. But as they get older, it's easier to try to understand what a third party might be thinking or feeling or seeing. And so it's easier to take that third party perspective, and especially when you hit that 16, 17 age where you're almost transitioning to adulthood, it's harder for kids to talk about, well, what do I think is wrong with it? Because then I'm thinking I'm a bad person and I'm really trying to find my identity. And that can be harming if I see myself in that negative way. So we could ask, what are some reasons that others would want you to quit smoking weed? And so They are in that Erickson stage of development where they are more likely to take that third party. I lost my mouse, that third party viewpoint of things. So then one study showed that it was more powerful even for asking them about a peer's opinion instead of an adult. They can more relate to a peer. So that's just another thing to keep in mind. And then we have acceptance. So adolescents need to be accepted. It's just important for them to fit in, to get that social acceptance, to belong. And it really helps them grow their self-esteem and their identity, and that it can cut down on that role confusion as they gain confidence in themselves. According to Erickson, acceptance is important to form that strong identity and to develop that sense of direction in life. That doesn't mean we have to agree with everything an adolescent says or their point of view. It means that we have to accept that is what they think. It doesn't mean that we agree with it. Then compassion. Compassion is really placing priority on the welfare of others and helping and supporting what's priority to them. We never lose sight of what's priority to us. But let's say we're working with an adolescent, it's almost like with an adult at times that we have to get their priority taken care of first, or they can't focus on anything else. And so having that compassion and putting their priority first, and we may at times have adolescents say, how would you know what it's like? You've never been there. It'd be easy to get pulled into that and say something like, well, yeah, I was your age once and I do get it. But that just really derails things and it makes it about us. And, it really is kind of a ducking mechanism that it takes the focus off of them. So instead, we could say something like, it's really hard for you to imagine that I could understand where you're coming from and that I'll be able to help. And see what they say then, so you can move on. So the next slide that we're going to look at is empowerment. And empowerment is one of those things that changed. And this was probably one of the biggest things that changed. It used to be evocation, drawing out, not instilling. But now they talk about empowerment. Empowerment does still include that evocation. It is part of it, but it's so much more. So we still draw out what's important to them, how they might want to go about things, what they might want to change. But we also spend a lot of time helping them try to find their own strengths and helping them appreciate and use what they already have. Being an adolescent can be such a tumultuous time in their life that sometimes they forget about their own strengths. And so it's important to call those out. And then we need to openly affirm their autonomy. And we can do that by saying, you can decide to do this. You might do this or you might do that. Just to let them know that we are not going to tell them what to do. We can guide them, but we can't direct them. And I think we know that about MI. So empowerment is really stepping up that game of giving them that autonomy. I should say letting them have it. We can't give it to them because we never had it for them. And so they also talk about it's letting go of the power we never had. And sometimes we forget that. We think we're adults. We can make adolescents or children do whatever we want to do. Well, they might comply with whatever we say so that they don't have some negative consequence, or they might have a positive reward for complying. But that doesn't mean that we have let go of that power just because they complied, or that we have power just because they complied. So it's almost like we're trying to pull them back as they're trying to float away and experience their life. And so anytime we can, let them have that power or not try to take that power from them, we should. It gives them, especially for the things that aren't so serious in life, it gives them practice to make those decisions, practice to have that autonomy while we're still there to guide them. So we might say something like, if you check your blood sugar twice this week, you can go to the concert. Or, if you don't do this, then this will happen. One thing I want to say right here, and I don't think I have it anywhere else in here, is in this book by Nar and Suarez, I'll just hold it up here. Um, they talk about how social media is so important to adolescents. And yet, what I often see is when an adolescent breaks the rules, that parents, the first thing they do will take away their phone, take away their social media. And that is probably one of the most harmful things to do. And, maybe limit it some, but to actually cut them off from peers can be damaging. And so other forms might be better to start with than to cut them off from their peers. And then moving into the skills of motivational interviewing. So we have these open-ended questions, and we know what those are, the ones that elicit a story versus one that would elicit data. And we're good at that, asking closed questions, collect that data, do the analysis, make the diagnosis, and fix the problem. That's what we do. And instead, open-ended questions, we're asking for their story. So like, if you decided to quit smoking, how would you do it? And using that hypothetical um, question. Sorry about that. And if you were to, not saying when you do, not making it concrete. And so just let them imagine if they were to, and they're more likely to be able to explore that. We can also ask, getting them to imagine, they're called imagining open questions. If you were to quit smoking, you were to quit drinking, what would your life look like in 6 months from now or a year from now? What would you be able to do then that you can't do now? Or we could even imagine the other way. And this is what Doctors Miller and Rolnick call querying the extremes. We could say, if you, or what was your life like before you started smoking weed, before you started skipping school? What did you have then that perhaps you don't have now because of that? And get them to reflect on that. And then moving on to affirmations. Affirmations are a reflection after all. We can't get an affirmation by asking or give one by asking a question. And so one thing that they changed in their book that was just published is they talk about simple and complex affirmations. And so I'm going to go on to the next slide and talk about that. So we know an affirmation is really pulling out somebody's strengths. And oftentimes it can be helpful because people get so down that they don't realize how strong they can be. So the simple affirmations, those are good. Those are like what praise, how they used to talk about praise. And nothing bad will happen if you give a simple affirmation, but the complex affirmations are the ones that will increase their self-efficacy to a higher level than the simple ones. So a simple statement recognizes that specific action at that specific time and some effort or intention. So it's not a global characteristic they have. It's just about something they did one time or at that time. So, what a kind thing to do. You stated that really well. You saw the warning signs and you took action, a very specific incident. Whereas complex affirmations are talking about some enduring strength, attribute, characteristic, something that they use in multiple situations. And so we can say, what you did took real courage and you're someone people can rely on. You're really dedicated to your health. You really want what's best for your family. Those would all be that over time affirmation. And those will be the best at, like I said, promoting that self efficacy. One thing I'm going to sidetrack myself here. One thing that I've noticed is, especially in certain parts of the country, we're in the Midwest, so we're one of them. People have a hard time talking about their strengths. We've been taught to be humble, and so we're not supposed to brag about ourselves. So just reflect on this question for a minute. And you don't have to answer it verbally or in the chat box, but just reflect on it. If I were to walk up and ask you, what are you good at? Most people would say, gosh, I don't know, golly gee, not much. We have a hard time talking about our strengths. But I found that if we make it situational, if we say, think about the last time you were able to accomplish something, although it was very difficult, and let them think about it for a minute and then say, what characteristics do you have that helped you do that? And people have a better ability to apply it to a situation than to just as a global characteristic. And that way we can pull out what they think their strengths are. So just a little side trip to what I had on my slides. And then moving on to reflections. We know there's the four kinds, of course, the simple where we paraphrase or repeat just one or two words, but we don't want to repeat it all and end up parroting. And then we have the complex reflections where we're picking up on something that is not being said or acknowledged. And we put that back in the reflection like a hypothesis, and we're just going to test it out and see what happens. And then we have the double-sided where we talk about both sides of things. And we might say something like, so smoking helps relieve your stress, and yet you're aware of the effect it has on your health. And you notice that we end on the side towards change. And so that's a huge part of those double-sided reflections. And then amplified reflections. I can't use amplified reflections because I have a hard time maintaining my voice in that way that just sounds steady, non-judgmental. But that's when we say something to the point, exaggerate it to the point we would expect that person to disavow it, to say, well, no, not exactly. But especially with adolescents, if we aren't able to control that tone of our voice and make sure it's just straightforward, we can come off as sounding sarcastic. And that can ruin the relationship and just derail what we're trying to do. One example that they gave in our answers was, Adderall doesn't really do anything. It's not a big deal, is what the teenager said. And in response, there's really no reason for you to stop using it. You would expect them to say, well, yeah, there's some reasons I should, but that's not going to happen. Another danger is they could agree with you. And then summaries, just one thing about summaries, a reminder, they have three parts. And the first one is announcing we're going to do it. So, before we move on, let me just make sure I got everything. And then we do the reflection in the middle. And again, just like double-sided reflections, we end on the positive. And then we ask the key question, where do you want to go from here? Did I get everything? Did you want to add anything? Just something to get them to talk more and to complete that communication to make sure it is wrapped up. All right, another change in their update is instead of the processes of MI, they now call them the tasks of MI. And they're still the same. They're still in the same order. They've kind of changed the thought though. So like engaging is, can we walk together through this? And then focusing is basically asking, where are we going? So guiding that conversation, but asking the adolescent, where are we going with this? And then evoking, well, why should we go there? What's the purpose? And then planning, how will we get there? So you can think about the processes like that as far as how it outlines our conversation with the adolescent. There's some other changes, like the writing reflex is now called the fixing reflex. Running head start is now called the pendulum shift or swing. And so if you want to know more updates, you can maybe go to this website I have here. I'm not sure if you have to purchase their 4th edition book to get to that website. I think I did have to log in when I went there. Shifting just a little bit and looking at Erickson's stages of psychosocial development. Of course, he has all of these stages, but we're going to specifically look at adolescents, 12 to 18, where they have that identity versus confusion. They're not sure who they are, where they're going, what they should be doing. And so they need to experiment with and develop their identity and their roles in society, their roles within the family, roles within their peer groups. If they have a job, roles within that, within their employment, they're trying to search for all of that. But the stage before stage 11 to 12, when they're just moving into that adolescence, they really need a lot of encouragement, because they are on that cusp and we need to help them move there. And so the further along a child is in that school age environment, the greater chance of being able to have that conversation with them about ambivalence, the pull between the different desires that they have. We know that that's a time they get to be strongly influenced by their peers. So they could end up getting in with the wrong crowd or not, and they would be pulled in those directions. We can use MI to focus on long-term goals for them. Not which college are you going to, of course, at 11 years old, but we can start helping them to figure things out in life. Interesting, those with cognitive development need us to guide them to focus on short-term goals as well and very concrete changes so they can get that success as they accomplish whatever those goals were. So when they first start, they need to demonstrate competency, and they might do it over and over and over again. And then they might actually accomplish it. They might actually go out on that limb and they see that it's safe and they enjoy being there. And then their peer group, they really need to fit into a group. And this is what it becomes so important for them to have friends and to have peers and to really feel like they fit in. And questions that we can ask them and guidance that we can give them can help them do that. So again, adolescent, who knew? Who knew that we could actually use MI to work with them? If adolescents are supported in their exploration and given the freedom to explore different roles that they might want to try out, they're likely to come out of the stage with that really strong sense of self and feeling of independence and control. Those adolescents who are told no all the time or told what to do, they don't get to make their own decisions. They don't get to practice with that role play or role, discovery. They aren't going to come out of it so healthy. And that's why MI too is so important to use with them, because we can explore, we can guide without taking that expert role and telling them what they have to do. I want to make sure I'm not missing anything. But we can also engage with them at that time to help them build relationships and start to connect with people and different kinds of people. Maybe not somebody that they're going to be lifelong friends with, but somebody who they can connect with. You will find adolescents negating any evidence we try to give them. So especially using education to try to get them to make a different decision. They will say things like, if you say, smoking can cause lung cancer, they're like, yeah, but I'm so young, I've got plenty of time to quit. Because, that's an old person disease and they don't see themselves susceptible. So they're really in that pre-contemplation phase. So a lot of times, especially at the beginning, our goal will be to engage with them and to start develop that relationship so that we can hopefully get them into contemplation. Let's see, what else did I have? Oh, affirmations. Extremely important with adolescents when they have so much turmoil that can go on in their lives, in school, with their peer groups. And I hate to say it, but with bullying, it seems like there's so much of that going on that giving them affirmations or providing affirmations can be very helpful. So they see themselves in a positive light, and they have more of the equipment they need to stand up for themselves and to continue to have that positive self-image. And then I think I've talked about needing to belong, and then their self-esteem. When they feel fully accepted, then their self-esteem will will be good. It'll be full. Some of this I might have gotten ahead of myself and talked about. So talking about identity again, they need to practice and feel valued and be part of a peer group. Oh, diversity. Diversity of experiences can be really good. And so when we're talking to them, finding out what are some of their interests. and, letting them know you don't have to do just one thing. I think like when a teenager starts a job, they're pushed into, well, you started it, now you have to stick with it. It's really a time in their life, and employers know this, that they need to experiment with different things. They need to experiment with different roles. They might go do different things that they hadn't ever thought of doing. And that way they can meet people who maybe have a viewpoint different than theirs, someone who has a background different than theirs. And that all adds to what they can incorporate into their worldview as well. I think that's it. I think I talked about everything else on there. So exploring, I must talk a lot because I just covered this stuff. Let them explore. They need to fit in, social relationships and identities. We'll move on to roadblocks. So roadblocks, it's easy to throw up roadblocks and not even realize what we're doing. And so we have this taking away their autonomy. And it doesn't mean that they can't be disciplined, if they really go astray. It just means that they can still have choices. And like I said earlier, like taking away the cell phone can be very detrimental to some degree. And so you might ask them, do you want to lose your phone for a day, or do you want to be, grounded for a day? Which one do you want? Giving them choices so they have the discipline, but they still have the autonomy to decide what they want. So giving them that menu of options, and not just for discipline, but for many things in their life. Do you want A, B, or C? And we can make sure those choices are all good choices, but yet we let them pick which one they want. Emphasizing inadequacies, we really need to look at what's right within children instead of what's wrong, or adolescents instead of what's wrong. And just remembering that at times they're doing the best that they can. There's a lot of struggles in those years. And so they are really doing the best they can. Making them feel better, or deny that there's a problem. Sometimes it makes us feel better to do that, and we don't want to hurt their feelings. And so we go ahead and downplay what's happened. And we might say it's not that serious. And so that way they feel better, we feel better, and there's no problem we have to confront. And then distracting. Maybe we don't want to talk about it. And so we change the subject. And we often use the yeah, buts. And that's a big one in motivational interviewing. Yeah, you might have done that, but what could you have done at the time? And that will create a situation where the adolescent will feel their behavior is okay. So, Nicole, I have to say, out of fear of going over, I talked really fast, and um, I'm to my case study. So it's not a real thorough case study, but I did that on purpose because I'm hoping that you can think about this situation or any other situation, phrases that you may use or things that you may have used in the past and how it could have been different. But just looking at this, well, I shouldn't have said I'm just about done. I see people dropping off. So John is a 17-year-old male. He does very well in school, and there are no behavior problems there when he is there. However, at home, he smokes, swears at his parents, and drinks heavily. I mean, how often do we see that where kids do good in school, but then they get home and their parents have troubles with them? So, because they think he is an alcoholic, and I put that in parentheses because labels are not good, they brought him in to be seen for his alcoholism. His parents leave the room, and John says, "Sure, now you can tell me I'm an alcoholic too. What is your best response?" And you can put this in the chat box if you would. So A, how do you feel when someone calls you that? B, John, I'm not interested in using labels. How do you feel about your drinking? C, well, it's getting you in trouble. Or D, from what I know, I would agree that you are an alcoholic. Which would be the best one to use when replying to him? Heather, thank you for having the courage to be the first to answer. I'm going to wait just another minute and see if anybody else will jump in and take a guess. All right. B is the best because, first of all, we want him to know that we're not interested in using labels. Labels are a bad thing within motivational interviewing because it's saying who someone is, not just that they do something, but who they are. But then asking him how he feels about his drinking is an important thing. Maybe he's okay with it. Maybe he knows he shouldn't do it, but he has peer pressure. It'll help us find out where he's coming from with that. C, of course, is not good because it's just not good. It's getting you in trouble. That's taking the expert role, taking away their autonomy. And from what I know, I would agree that you're an alcoholic. Again, labeling, not a good thing. Question 2, the provider says, obviously you can control your behavior. After all, you do well in school. I think you should just do the same thing at home. Which roadblock is this? Is this distracting, emphasizing inadequacies, taking away autonomy, or trying to make him feel better? This one's a little difficult. And maybe I'll just go ahead and discuss it. So the one for this would be taking away autonomy, telling him what he thinks he should do, not letting him weigh in on what he thinks about it, not giving him choices, but just telling him, you should just do the same thing at home. So that would be taking away his autonomy. 3, which of the following would be the best question to ask? What do you know? And let's say he's 17, or I should say, I'll remind you he's 17. What do you know about the consequences of drinking? Or why would others worry about your drinking? So again, if you could put it in the chat box, or if you're willing to, you can unmute and talk as well. All right, I see several people put B. And yes, because if you remember, taking that third party perspective can be more easily done with a late teen. And so it's harder for them to say what I think is bad about drinking because I think it's great. All my friends do it. But what are others worried about? And then John asks the provider, do you think I should quit drinking? What is the best response? What's most important is what you think. You already know what I think. Why do you ask me that? And what's important is that your parents want you to quit. A, B, C, or D. All right, Amy, thank you for guessing first. I shouldn't say guessing. That's not a good thing to say. Thank you for having the courage to answer first. Yes, that is A. What is most important is what you think. That is audibly acknowledging his autonomy, that whatever he thinks is most important. So now I'm going to count on all of you to think about a time you've been working with someone and perhaps you said something. I'm going to stop sharing my screen. You said something that didn't go well, or you wished you had said something different, or if you did have an example of using motivational interviewing that really did go well, sharing that with us too so we can all learn.
And if you want to unmute, if you want to turn your camera on and participate in the conversation across the community, you certainly can do that at this point.
I'm going to give you a minute to think about it because you might be sitting there waiting for someone else to go first. And Erica, for you too, if there's a time you've had to work with someone that maybe you could have used motivational interviewing with. Let me think how else I can word it to maybe get you excited and prompt you to share something.
I think in our previous conversations, even with Dr. Wissa, who joined us from Seattle Children's last time, we talked about engagement strategies for families and treatment planning, and the reservations that people have about either medications or venturing down the path of treatment decisions. Getting not just the patient, adolescent, but also parents engaged in like the conversation that unfolds in that process is a great place to use motivational interviewing. So if there's anybody who has a treatment kind of conversation to have with either the adolescents and their resistance perhaps to wanting, or they're not engaged yet in wanting to pursue treatment, that you can think about and want to staff that here would be great.
And while they're thinking, I'll just say, oh, is someone else going to talk? Oh, I got so excited. I didn't touch on that. Go ahead, April.
I do think this is something that can be utilized with adults as well. We have, working in infectious disease, we have a patient population that is non-compliant, I would say. So this is some ways that we could utilize this in our clinic as well.
Yeah, absolutely. This can be used with adults, and oftentimes that's where, when I do training, that's more where our focus is. And I would just say, instead of non-compliant, it seemed like you struggled saying that word. What's easier to say is they're choosing not to adhere to the recommended treatment plan, or even taking out the word choosing, because it might not be a true choice. There might be a social determinant of health that is stopping them. But yes, absolutely, we can use it with adults, and using it with adults who their child is being seen, often they bring them in because they're the problem. And then perhaps the parents are part of it as well. And so, talking to them can be helpful, but I don't have any science behind saying this, but I would think it would be helpful to talk to the parents alone outside of the child, so that it's just they're more free to talk and it doesn't feel like they're being scolded in front of their child. Just like I had in the scenario, the parents leave the room and him talking by himself. At 17, he should be able to do that.
Roxy, can you expand upon a little bit more utilizing either the pediatric or the adult population? Because we in healthcare in the past have used the terminology non-adherent, non-compliant, and it gives a very negative connotation, like you said, like they're choosing to do this.
Yeah.
And it's their choice. So phrase that in the MI verbiage.
Yeah, and the MI verbiage.
Help us better understand.
Say that again.
Yeah, just go ahead and state it in the MI verbiage.
Okay, and I'll have to tell you that this isn't in any book, and actually it was a class up in Fargo several years ago that we took the time to brainstorm what would seem kinder, what would be MI adherent, that wouldn't be judgmental. And what we came up with was not adhering to the recommended treatment plan. It's recommended treatment plan because they don't have to do it. And it's not that they're not complying with it, because compliance has the underlying message that we ever had or should have had the power to make someone comply, make someone to do something. And so not adhering to the recommended treatment plan could mean maybe they are choosing not to, but maybe there is that social determinant. Maybe they're not taking their meds because they can't afford them and they're prideful and don't want to tell us that. And so, deviating a little bit, that's why it's so important that we do engage, so that we build that trust and they'll tell us. But I'll tell you, when I hear non-compliant now, it's gotten so ingrained in me that I just automatically want to respond to it. And I have a feeling April was feeling the same way. And April, you can say if I'm right or wrong, but you hesitated saying it. And so I'm wondering if you had heard that before too.
Yes.
Have you heard of any ways that people have said it differently?
No, I mean, just how you've explained it. And we do run into a lot of barriers for our patients, so I would
Right.
say that that's a big thing with ours. So,
And when you say barriers, this is another side thought. Jane had asked about using it with adults, and oftentimes we'll say, just to try to find out why, we'll say, what are your barriers? What's stopping you? And that can actually get people into the mindset of talking about why they can't do this. Instead, if we were to make one small switch and say instead, what would you need to or what would need to change so that you could do this? We're still going to hear their barriers, right? But they're going to be in that mindset of solving the problem instead of just listing the problem or complaining about the problem. They'll actually start to problem solve. So when we're talking to especially adults, asking them instead what would need to change so that you can take your medications every day. So that'll help us find their barriers. So like I said, a little off to the side from what you were saying, but I just had that thought, so I shared.
I think it also helps to extend the treatment plan and the team members that need to be present or engaged with the family to help them achieve their goals in healthcare.
Yep.
Is there a time when not to use motivational interviewing? If I think about April's scenario, I'm thinking about vaccinations, I'm thinking about religion, ways in which people won't get one because it doesn't fit with another part of their life.
That's a tricky question, Jen, because with adolescents, NAR and Sura say you should always use it with adolescents. But Miller and Rolnick talk about how there is a time and place when you don't use it. And I equate it to, and I say in my classes, if I'm about to step off the curb to cross the street and you see a bus coming, I don't want you to say, Roxy, can we talk about what might happen if you continue? I want you to grab you by the arm and pull me back, right? So with somebody who has, like, say their A1C is 9 or 10, we might be a little bit more directive or a little bit more concise with what we say. But we still want to try to be that guide as much as possible. Now, MI should never be used. Vaccinations became a very political point of view. And I tried to always just not talk about the issue. But really, if somebody doesn't want a vaccination, but we believe that they should get one, and it's so controversial, do we then want to train people how to use MI to get them to talk people into doing it? Because that's not what MI is. And years ago, I had a local branch of the judicial system reach out to me and wanted MI for their officers. And I said, what's your purpose? Well, when we're interviewing people. And I said, so like you want to get a guilty confession from them? Well, I didn't say that. And I said, I'll tell you right now, I'm not doing it. I won't train somebody in MI so they can manipulate people. And at times that's when we can. But to more directly answer your question, yes, Miller and Rolnick, and that's who I listen to, say that there is a time and a place. If somebody has a new diagnosis of diabetes, we don't ask them, would you mind if I talk to you about how to check your blood sugar? We just tell them, I need to show you how to check your blood sugar. So great question, Jen. I hope I answered it. If not, if you have a follow-up, let me know. How about someone else? Hopefully we've demonstrated it's not too scary or terrible to talk. But I've been in your boat before, where you don't really want to talk in a group.
I would like to ask a question. Thank you, Roxy, very much for everybody that was involved with this education. It's been very helpful. I have the opportunity and privilege of working on the inpatient behavioral health unit, and there are times when I hear pretty frequent sustained talk, and sometimes it just, no matter how many evoking types of questions or affirmations that I do, it feels like I'm going in circles with them. How long do you engage when there is sustained talk? And I know that that's a very broad question. How do you know, and when do you wrap it up, and how do you wrap it up when there's a lot of sustained talk and back and forth that occurs?
Well, sometimes with sustained talk, we have to just outright acknowledge it. And the running head start, now they call it the pendulum shift. That is what that is asking them, give me an example, like what type of behavior would you be trying to change? Would it be like smoking, drinking?
I guess the one that most frequently is coming to my mind is we were talking about planning ahead in the schedules for grocery shopping, and creating time for planning ahead for self-nourishment.
Okay, so in that case, what you could say is, so what do you like about not doing that? What do you find good about not doing that? And let them, for lack of a better phrase, get it out of their system. Let them know that they are heard. Oftentimes, when people keep repeating the same thing over and over, it can be because they don't feel like anyone's listening. And so there are times where we have to do that running head start and actually, or that pendulum shift, is to actually ask them, what's so good about what you're currently doing? And then we can go on, after they get all of that out, then we can go on and say, if you were to do that, and you be sure you use that hypothetical language, if you were able to do this pre-planning for nourishment, what good would come out of that?
I really like that opportunity of giving them the chance to speak of all the frustrations that's hindering their actions first and then proceeding forward. Thank you for that suggestion.
Yeah. Sure. And we don't talk about that often, but that comes straight from Miller and Rolnick and different ways they have to responding to sustained talk. So Taylor, are you in the Fargo region or where are you at?
Yes, I'm in Fargo.
Okay. I don't know if you're part of the group, but they recently asked me to, I have a presentation on motivational interviewing with inpatient behavioral health. And they asked me to repeat that. So I have a couple of sessions of that scheduled. If you want to know more, reach out to me afterwards.
Excellent. I will definitely do that. Thank you.
Okay, you're welcome. All right. How about another person? Do we have anybody who works with pediatrics? That's probably a silly question because of this group. But is there anyone who specifically works with pediatrics and have had a difficult time with parents, as Jen brought up? All right, Jen, what other questions do you have? Or Nicole, what questions do you have?
I had one. Oh, Constance has something, I think.
So
Okay,
so I work in the behavioral health inpatient unit in Thief River Falls, and we have adolescent group, and we have a couple, one of them's technically adult, but she's adolescent like, and we, with that real concrete, suicidal, want to self-injure mindset. And I know we've tried some type of motivational interviewing, asking, what do you think, will be helpful, or what did feeling good, look like for you, and those kinds of things. But we have this adolescent currently, and she is determined to self-injure because she doesn't want to go home. And she's tried all of the placement options. You know, she's been to residential treatments and she's done a lot of those options. Do you have suggestions on what kind of ways we could approach her to see if she can help guide us and what would be helpful for her?
Well, first, I guess I would want to ask why she was so adamant she doesn't want to go home.
I think what she got this time she got in trouble and stole like $1,000 from a brother, and there was consequences at home. And so I think that was a big motivator for her coming in, but she has consistently been in placements for, I would say, the last 2-ish years.
I'm going to just tell you my first response to that, right or wrong. And that is, when there's a mental health issue, I'm a lot more cautious in talking about MI, because if she's not being treated to deal with that part of it, then I would hate for somebody just to try to use MI and not have it medically addressed. So know that as I answer this question. But has she been like this all of her life, or is it just more recent?
Not 100% sure the answer to that. I know Dad says that he's just really been struggling, and I know for sure for the past 3+ years,
Okay.
They've been having issues.
So, maybe asking her, what was life like before all of this started happening? How did you feel within yourself? What could you do then that maybe now isn't as easy to do? Having her reflect on that, and then ask her, if we could resolve all of this and things were peaceful at home, what would that mean to you?
Sure.
Instead of asking about specific actions, maybe more globally, she would be able to talk about it.
Sure.
I don't know if that helped, but that's a tough one. I would really want to make sure first she was medically treated.
Yeah, and I mean, she's, psychiatry is involved, and we have a therapist in
Yeah.
that too, but it just feels like we're in a cycle, and she's been here more than once, and just trying to find some solutions.
And have you guys asked her what she gets out of self-harm? Like, what's the payoff?
I can't answer that 100% sure. I'm more in a leadership role than I am on the floor a lot of the time. So I do know that the therapists have worked with her some. I know our social worker has tried different, MI type approaches with her to try to get her to talk or open up, but we're just not winning.
Yeah. And I would say that if a therapist, psychiatrist, if they can't get into her and help her make different decisions, I don't know if the people who are working with her then, if they're nurses, but I would hate for what a nurse is doing to contradict what a physician is doing as well.
Yeah.
So how's that for non-answer?
Well, I appreciate your feedback.
Well, thank you for the question. How about one more? Jennifer H., were you just going to unmute?
Yeah, I have it's regarding an adult though. I hope you don't mind me asking
No,
about an adult, but
not at all.
an older adult. I've been working with her quite a while in therapy, and she tells me that she is very unmotivated. She's very sedentary at home, doesn't go out hardly ever. Her goals are that she wants to get healthier. She is very unhealthy she's very obese and lots of other comorbidities. I like the question that you said of what do you like about what you're doing now? So I definitely will try that. But do you have any other suggestions to help with the motivation that she says she's struggling with?
Well, number one, when somebody says they want to be healthier, my first question is always, what does that mean to you?
Mm-hmm.
Healthier might mean somebody running a marathon, but for someone like her, it might be walking around the apartment complex.
Yeah.
And so finding out what does healthier mean to you. And then you could ask her, what do you get out of, using that pendulum shift? What's your payoff for not doing this? And we know that there's probably a lot of payoff for not doing it, because change is hard, right? And it takes a lot of work. but we could ask, what would it mean to you? Maybe she's got something more going on. Is she afraid to go out of the house? Does she have a fear of being out in public because of her obesity?
Yeah,
She,
she
yeah.
does. But even like I've tried to start small, like, okay, just step outside the door, like for 5 minutes or whatever that may be. And she'll say that that goal would be achievable. And it's okay with her to go outside, like outside her house, she feels comfortable with. But getting to her to actually do it and follow through has been the difficult thing.
So stepping outside the door, was that a suggestion from you or did that come from her?
It came from her because I asked her, what do you think would be achievable or something that you could do?
And did you ask her why she didn't follow through with it?
She said she just kind of forgets about things and
Well,
goals.
and I'm going to offer a suggestion if it's okay.
Yep.
Have her write it down on a piece of paper and put it somewhere where she won't forget. Bathroom mirror, someplace where
Okay.
she sees. It'll be a
Mhm.
lot harder for her to say she forgets if it's in front of her all the time.
Right.
And maybe even have her write it like, I will walk outside my door today. Just instead of just saying what the behavior is, I will walk outside my door today because it's the first step in my plan. So that she can start building those baby steps.
Okay. Okay. Another thought I had too, just since the last time I saw her is, I wonder if that's why that's her goal. Like, is that truly her goal, or is that what she feels like her goal should be, is to get healthier?
That's a great question to ask her, Jennifer. That's
Mhm.
a great question to ask her. I had a health coach at Sanford who had worked with this patient for a long, long time. And her problem was she wouldn't even set a goal. And they had met for 6 months. And my recommendation to her was to say, we've met for 6 months and you have not made progress on even setting a goal. So I'm wondering, how important is it to you that we actually meet? Now, keep in mind, this was someone who wanted to meet with her. And I know a lot of the people that all of you see are people that have been identified that they need somebody to work with them and they're not necessarily all that happy about it. So I don't know which
Mhm.
one she falls in. I mean, is there the option to say to her, let's take a break?
Yeah,
And do you feel that you're her social visit, maybe?
probably. Yeah.
Yeah. And that happens especially with elderly who are, reclusive. They're lonely. And
Yeah.
if she can count on you being there once a week or however often, she won't feel like she needs to follow through because you're going to come no matter what. And so I don't want to suggest, just telling her I'm never coming back, but say, I'm wondering if right now is a good time to take a break so that you can really think about goals that you can achieve or how important this really is to you. And then maybe skip a week or whatever frequency you meet with her.
Yeah, that's a good point.
So, well, it
Thank
is
you.
1:00. I want to thank you guys for all the questions. I was a little bit of a slow start, but when you warmed up, it was really, really good. So thank you for that. And I hope that I was able to help somewhat. So
Thank you so much for the great presentation. This was great information and thanks for all the great participation. That's always nice.
yes, it is very nice. So, all right. Well, anything for me, Jen, or
I was just going to say there should be a survey in the chat to complete for the.
I'll have to send that out in the email, and I'll send out the presentation with that to everybody.
Okay, great. Very good. And so I know there's lots of new names in here today as well. So if you could please, for the next session, if you were invited into the series of the third Wednesday ECHO sessions, that you do have to register for each session. Each clinic has its own registration. So I know you registered today for this one, but when it comes up again, the third Wednesday of April, you will need to register again. And we will have one the first Wednesday of April as well. And that email will be coming out to you very soon.
Okay, so Erica, did you say, or Nicole, sorry, did you say you're going to send them the presentation handout?
Yes, yes.
I thought we had agreed you were not going to do that.
Well, if normally we do, and so, but no, if and so we can talk about that, and so.
Okay.
Yep,
Okay,
and certainly if anybody has questions for Roxy, they can reach out directly.
yes, please do. Oh. Okay, well, will you at least convert it to a PDF before you send it out?
Absolutely.
Okay. All right, then that's fine.